Hi, everyone. Thanks so much for joining us for our virtual presentation today. The title of our talk is Determining Outcomes of Phalloplasty and Metoidioplasty, a community-directed way forward. My name is Leo Rutherford. I'm a PhD candidate at the University of Victoria in British Columbia, Canada, and I'm joined today by Aeron Stark, who is a research assistant at the University of Victoria. Our co-authors for this presentation and in general for our project are listed down here in alphabetical order. And you'll hear a little bit more about them and their involvement later on in the talk. Also, a thank you to my research supervisors who are not mentioned here, Nathan Lachowski and Aaron DeVore of the University of Victoria and Aidan Scheim from Drexel University. We are very thankful to our sponsors and partners for this research project, which include the Canadian Institute for Health Research, the Strategy for Patient-Oriented Research, the BC Support Unit, University of Victoria, Community-Based Research Center in Vancouver, and Transcare BC. This is an overview of our presentation today. Aeron will be giving an introduction of what phalloplasty and metoidioplasty are, and then some background information about how currently outcomes are determined in academic and medical literature. Then it'll pass back over to me and I will talk to you about our project, what we're working on, and how what we're doing is different from the current research on this topic. And lastly, I'll share some future directions, some thought about our knowledge translation products, and how we hope our research will help the community. I will pass it over to Aeron now. Aeron, just let me know when I should advance the slides.
I'm just going to talk quickly about what phalloplasty and metoidioplasty are. So phalloplasty and metoidioplasty are two related but distinct surgeries, and they're used as gender-affirming surgeries for trans men and non-binary people. They each have strengths, drawbacks, limitations, and complications, and they can co-occur with several additional surgeries, either during the first instance of genital surgery or at later times, depending on surgeon preference and patient desire. So I'm going to go into more detail about each procedure on the next few slides, and I will be using some anatomical terms. So phalloplasty has been described as a modular set of procedures that can be combined, mixed, and matched to meet the needs of each individual patient due to the numerous options of additional surgeries. They can be conducted in several different ways with numerous variations occurring over time and geographic region. And they can be combined with vaginectomy, which is the removal of vagina and cervix and closure of vaginal opening. Scrotoplasty, which is the creation of scrotum using labia majora, which also may include testicular implants, urethral lengthening, and erectile implant. Multiple options for graft sites include thigh, arm, abdomen, and back. Next slide. Metoidioplasty, or what's commonly called META, was specifically created for trans men, and it utilizes the increased size of the clitoris that is enlarged due to testosterone. The clitoral ligaments are released, and labial tissue is used to bulk up the neophallus. The urethra can be extended beyond its position into the newly lengthened penis, which is called urethral lengthening. There's no donor site, so there's no scarring. The recovery is shorter, and there's usually less complications for that procedure. I'm going to go a bit of background about how current outcomes are determined in the literature. Surgical outcomes are characteristics that change as a result of surgical intervention. And surgeons are traditionally the determiners of what a successful surgical outcome is. And phalloplasty and metoidioplasty are often benchmarked by a set of ideal results. And results are deemed successful if there's a satisfactory appearance, the ability to urinate, able to have penetrative sex, and if there is erotic and tactile sensation. And outcomes are currently measured using clinical exams, interviews, and questionnaires. Clinical exams most commonly reported were sexual function, complication rates, and satisfaction with aesthetic results. Among studies that use interviews with clinical exams, complications, aesthetic satisfaction, and erogenous sensation were most commonly used to determine results. In questionnaires, it was mental health and body image, and also psychosocial aspects such as quality of life, surgical satisfaction, and social support. Anxiety and depression were the most common aspects of mental health reported in questionnaires, and dysphoria was the most commonly included aspect of body image. There are a few limitations of current literature. The overall sample sizes are very small. Most are on average 24 patients. They utilize convenient sampling, which is useful for ease of collecting data, but this type of sampling does not generate data that can represent a whole population. Rather, the data only speaks to outcomes of participants. There's single instances of data collection, and no patients are usually consulted in what outcomes should be measured. And most of the data collected via clinical exams are already part of follow-up and routine medical reporting, such as complication rates, needs for surgeries, scar care. There's not very many questions about mental health and body image. Thank you.
Thanks so much, Aeron. I'm excited to talk to you all now about our project. The title of our research project is Progress for Metoidioplasty and Phalloplasty. Progress is an acronym that stands for Patient-Reported Outcomes of Genital Reconstruction and Experiences of Surgical Satisfaction. The logo that you see here is a work in progress, pun intended, but I'll be working with a graphic designer to change that up soon. To sum up the goal for our project, we're seeking to make change both in the academic and medical literature about phalloplasty and metoidioplasty, and more importantly, give patients more information about what to expect if they're going to have phalloplasty and metoidioplasty, including what the recovery and preparation process is like. Other than my research supervisors, who I briefly mentioned at the beginning of this call, the rest of our team of 8 is made up of individuals with lived experience of either phalloplasty and or metoidioplasty. So we are making decisions together based on personal experience and knowledge that we have and information that's been shared with us by other community members. We come from across Canada and the United States, and we have experiences with different surgical teams and other different experiences of life. We are hopeful to recruit 300 participants from across the world to participate in a survey that we are currently developing and soon will be out. While other research projects are consulting or including a few former patients, this project is designed by and for those of us with lived experience of surgery. Surgeons have conducted research about outcomes that are important to them, but there's much more to consider than complications and other items that are currently discussed in academic literature, as Aeron mentioned. So our survey is including a number of topics that we've identified as important and lacking in current literature. And these are a few examples on the screen. So patient preparedness for surgery includes what people do to get ready for surgery and how they feel going into it, including the informed consent process and what their process of surgical readiness evaluations look like and whether or not that's useful or helpful in preparing them, as well as what kind of knowledge people have about surgery going into it. Doctor-patient relationships are also something that's not mentioned often in the current literature, and we think that relationships with surgeons and surgical teams might in some way impact patient experiences. Postoperative depression is also not mentioned very often in academic literature, and something that we've noticed is important to discuss as part of the both preparation for surgery and in general after surgery. So here's a little bit about our process. So if you're wondering where's our research project at now, we are currently developing the survey that we're going to be using as a data collection tool. After a number of meetings, we have decided on some topic areas to include, which include the items that I mentioned before and an additional few as well. We're still designing some survey questions and we're making decisions currently by simple majority vote. Likely late in the fall, we will launch our survey. As I said, it will be available internationally. It'll be in English and possibly translated into French. Our data analysis and interpretation will highlight aspects of preparing for, undergoing, and recovering from surgery that might impact well-being. And it will highlight whether certain groups of people experience poor outcomes of surgical care, poor relationships with surgeons, and other health outcomes. Our knowledge translation activities will focus first and foremost on items that are important for community members. While we haven't decided quite yet exactly what knowledge translation activities will occur, I'm quite confident that we will at least have community reports, infographics, social media content, and I'm hopeful for a simple data dashboard where people can conduct simple statistical analyses to look at whatever outcomes they're interested in our data. This project is just the beginning for me as it's part of my dissertation. I plan after completion of my PhD to continue work in this area to address the lack of trans-led and trans-created research on these topic areas and the lack of holistic outcome measures for phalloplasty and metoidioplasty. It's our hope as a group that future research on transition-related surgeries uses similar robust community inclusion to ensure that research is meaningful and appropriate to our community. I'm sad that we couldn't be in person or even live with you all today, but you can check out more on our website soon. It's currently in development, and here's a little snippet on the side of what you'll see when you visit our website. But stay tuned there for some bios from our team, some information about why the research is important to us, and photos. You can check that out when you get a chance. Thank you so much for attending our talk, and thank you to the organizers for creating this space to highlight trans-led research that is important to us. Feel free to reach out to me via email, my personal UVic email there, or the study email, theprogressstudy@gmail.com. I'm sorry I couldn't answer your questions live. I hope you enjoy the rest of the conference.